everyone, welcome to the Whiteboard Wisdom session. I'm Dr. Jordan Rigby at ViewPoint Center. Today I want to spend a little bit of time talking about balancing mental health, or really just taking care of yourself with everything else on top of school. And so we all struggle with mental health at times. There are a lot of things that go on in our lives. Sometimes it's daily stress. Sometimes we go through a rough patch. Sometimes it's serious mental illness, but we all struggle. During these tough times, it can be difficult for teens to balance out taking care of themselves and school, kind of working through all of that. And we know that they've got to go to school. That's just part of adolescence. And so what are some things that you can do when you are trying to balance out taking care of yourself and on top of school? So what I put up here is a couple of things that I could think of that might be of use. First one is physical, and that's really physical health. Is taking care of your physical health will take care of your mental health as well. Next one, stress management. This can have a lot to do with, coping skills and a lot of different things. The thing I really want to highlight is helping teens essentially be nice to themselves. Really, not get as angry or as upset when things are not going well or they're struggling. Just be nice to yourself. Next one has to do with realistic goals. This is a big one because we go into school, we go into a new year, we go into something with expectations, with goals in mind. And when things are tough, sometimes we have to alter those goals, or we have to realize that it's going to take more energy to complete those goals. Next one is avoid risky behavior. Mostly what I was thinking of is substance use or substance misuse. That's just going to make things more difficult. It's going to cause more problems than anything else. Last two have to do with social support network and getting help when needed. These are pretty similar. One of the things that I want to highlight is really setting up an environment to help teens communicate that they're struggling, that they're having a hard time. And we do this by setting up a setting, classroom, home life environment that is validating and supporting. And so one of the things that we can do to do all these things is really essentially work on all of them at the same time, and that will help our mental health situation. So I've invited Jen Capellen in. She's one of our teachers at ViewPoint Center to help kind of illustrate how we do this in the classroom.
Hey, Jordan.
Yeah, thanks for coming, Jen.
Thank you. I'm Jen Capellen. I'm a classroom teacher at ViewPoint. And we really do try to do what you just talked about, set up a very supportive and encompassing classroom environment. And most of the times questions that come from parents have to do with school, because parents are obviously concerned.
It's
Absolutely.
important. Yeah.
So I want to highlight 3 questions that kind of take you through some questions that I normally get from parents. And the first one is, what does school look like at ViewPoint, and do you do school? And we absolutely give kids an opportunity to engage in a classroom setting. They get an opportunity to engage in PE, they get art, they also do a general study class with me. So we're really trying to facilitate a normal classroom setting where they're just asked to engage in everyday activities that would be something that would happen in a classroom setting.
Right.
So we want to see obviously how they're managing that, and what comes into play when they do get stressed, and what are they using as coping skills, and are they avoiding other peers who might be risky and impacting their school.
Kind of seeing how well they balance this stuff out in a classroom.
Absolutely. So yes, they do get to do school at ViewPoint. Second thing is, what does it look like? We really do try to give them support. I try to take myself out of the disciplinarian facilitator role. I'm just there to observe and assess and try to get a sense of what are your strengths academically, what are your weaknesses, what are you going to struggle with, what are some goals you have for the upcoming school year, so that we get a sense of what is important for you in school.
It probably really helps to add whatever you can to another support system.
Absolutely.
Or somebody else in that network.
Yeah, and I know that students end up, having discussions with me about, hey, I really can't stand math. That's when I freak out the most. I get so anxious. So that's just a really good vantage point for me to be able to pass that on to the treatment team and have that in mind when we recommend something for the future.
Right.
Third question that we often get asked is, what should we do about work from home? Like, my student is finishing up geometry, or we're really concerned that they're going to miss out on credits. And as professionals, we really think that this is a good time to sort of pause those activities and for them to really focus on their mental health and what's going on. Like, obviously an acute situation brought them here, so we really want to try to get a sense of what's happening and how we can help them in the future.
Yeah. Thank you so much, Jen, for coming by and explaining some of this. Like always, if you have any questions, feel free to reach out with anybody in admissions at ViewPoint Center to answer anything you have.